distinguished members of the Global and Regional Polio Certification Commissions, National Certification Committees, representatives of Ministries of Health and partner agencies, WHO colleagues, ladies and gentlemen. I welcome you to this 14th meeting of the Southeast Asia Regional Certification Commission for Polio Eradication, or RCCPE, the second to be conducted online. Since September 2020, when this commission last met, the COVID-19 pandemic has continued to upend lives and livelihoods, both globally and in our region. It has put immense pressure on essential health service delivery, including for routine immunization and vaccine preventable disease surveillance. Both programs are critical to sustaining region-wide control of vaccine preventable diseases as well as the region's polio-free status. Last year, at the 13th RCCPE meeting, I spoke about how the region's 5 polio priority countries had experienced nationwide or partial lockdowns, which had disrupted immunization and surveillance activities. Regional capacity building and coordination activities had been postponed, and in many at risk areas, the human workforce and polio infrastructure had been repurposed, providing much needed support to the COVID-19 response. The polio workforce can be justly proud of its contributions to the COVID-19 response, which have highlighted the commitment and versatility of polio staff, as well as the tremendous resilience of the region's immunization systems, including for polio. In 2019, 10 countries of the region had achieved 90% or higher coverage with 3 doses of oral poliovirus vaccine, which is OPV3. 7 countries of the region had achieved 90% or more coverage with inactivated polio vaccine, which is IPV. In 2020, 5 countries of the region maintained 90% OPV3 coverage, and 6 countries maintained 90% IPV coverage. Amid the pandemic response, India and Timor-Leste conducted several supplementary immunization activities using bivalent OPV. India conducted one national SIA that reached more than 160 million children and 2 subnational SIAs that covered more than 30 million children in each campaign. Timor-Leste conducted SIAs in 13 high-risk municipalities, covering more than 46,000 children. In several countries of the region, OPV3 and IPV coverage has nevertheless decreased, causing regional OPV3 coverage to reduce to 83% in 2020 compared with 90% in 2019, and IPV coverage to reduce to 77% from 83% in the same period. Need it be said, this is a major concern. Vaccine preventable disease surveillance, including for acute flaccid paralysis as well as environmental surveillance, has been greatly affected. We see significant variance between countries and also subnationally. The main reason for this is the repurposing of staff to support the COVID-19 response, in addition to restrictions on movement caused by lockdowns. In other words, such gaps would have been difficult, almost impossible to avoid. Commendably, all countries of the region have developed detailed plans to revive immunization services, to improve vaccination coverage, and have sustained laboratory supported AFP surveillance to detect poliovirus transmission. The region's network of 16 polio laboratories continues to perform with several quality assurance mechanisms in place. While overall polio immunization coverage, AFP reporting, and environmental surveillance have shown signs of recovery in several countries of the region, they are yet to return to pre COVID 19 levels. The impact of the pandemic on polio activities has left all countries of the region susceptible to imported wild poliovirus from polio endemic countries, as well as to circulating vaccine derived poliovirus, especially type 2. It is therefore imperative that all countries strengthen polio outbreak preparedness and response capacities. The region's integrated network for surveillance and immunization is one of the key reasons that Southeast Asia is the most advanced region in polio transition. However, ongoing advocacy with donors and partners remains critical to ensure sustainability. Importantly, we cannot look at sustaining the region's polio free status in isolation. At the global level, Afghanistan and Pakistan continue to serve as cross border reservoirs with co circulation of wild poliovirus type 1 and circulating vaccine derived poliovirus type 2. In several parts of the world, we face an increasing public health emergency associated with circulating vaccine derived poliovirus type 2. In 2020, almost 10,000 cases of circulating vaccine derived poliovirus type 2 and over 400 positive environmental samples were reported from 25 countries globally, primarily in Africa, but also in Afghanistan, Pakistan, Egypt, Iran, the Philippines, and Tajikistan. As is so often said about COVID 19, no one is safe until we are all safe. To this end, the Global Polio Eradication Initiative, in collaboration with partners and stakeholders, has developed a revised and strengthened polio eradication strategy 2022-2026, which will come into force next January with a set of actions to strengthen GPEI. The strategy is built on two primary goals. First, to permanently interrupt all poliovirus transmission in endemic countries. And second, to stop circulating vaccine derived poliovirus transmission and prevent outbreaks in non endemic countries. At the recently concluded 74th session of the Regional Committee for Southeast Asia, countries of the region expressed unanimous support for the strategy, identifying Goal 2 as specially relevant to the region. In coming deliberations, I urge you to carefully assess the region's polio free status and also to remain forward thinking, identifying innovative ways to achieve the strategy's targets and goals with the overall aim of safeguarding our success until global eradication is achieved. I wish you productive deliberations and look forward to being apprised of the outcomes. Thank you.